Good morning, everyone. I am thrilled to welcome you back for the second day of Capitol Hill Ocean Week here on Oceans Live. My name is Kate Thompson from NOAA's Office of National Marine Sanctuaries, and I will be your host for this and every session of Capitol Hill Ocean Talk live from the museum in Washington, D.C. CHOW just finished its first session of the day on tourism and recreation, and we will continue to explore that theme with a discussion on the health and economic benefits of outdoor recreation. But before we introduce our guests, I wanted to tell you about the highlights from not just any prom, but the ocean prom we attended last night. The National Marine Sanctuary Foundation hosted the 13th Annual Ocean Awards Gala at the Ronald Reagan Building and International Trade Center in Washington, D.C. Many of the ocean's most influential, such as the winner of the Lifetime Achievement Award, Dr. Jeremy Jackson, came out in black tie attire to celebrate our ocean. Attendees were even treated to a message from President and Mrs. George W. Bush, where they accepted the Leadership Award via video. The President and Mrs. Bush were recognized for their work to add 4 national monuments to our nation's system of marine protected areas. The foundation also honored Volunteer of the Year, Richard Matzinger from Greater Farallones National Marine Sanctuary. And I also wanted to give another shout out to one of our pin sites at the Thunder Bay Great Lakes Maritime Heritage Center in Alpena, Michigan. Don't forget to be part of our conversation here and tweet us questions at #CHOW2015 or chat us on oceanslive.org. Now back to today's panel on outdoor recreation. I am very happy to be joined by my fellow sanctuary colleague, Maria Brown, Superintendent of Greater Farallones National Marine Sanctuary off the northern coast of California. Her management responsibilities cover ocean and estuarine waters adjacent to an urban center of nearly 8 million people. We'll talk to Maria later about yesterday's special sanctuary announcement. In studio, we also have with us Dr. Robert Zarr, a board-certified pediatrician at Unity Healthcare in DC metro area, where he cares for low-income immigrant populations. Dr. Zarr is also the creator and founder of the DC Park Prescription Project, which we will discuss shortly, and he currently serves as president of Physicians for a National Health Program. And last but certainly not least, we have Matt Gove, the Mid-Atlantic Policy Manager for the Surfrider Foundation. Matt has a master's degree from Duke University and worked for the National Oceanic and Atmospheric Administration, or NOAA, and the state of New York. Thanks everybody so much for joining me in the studio today. I'm really excited about our topics and to talk about it a little bit. But before we get there, I really quickly, National Marine Sanctuaries actually provide places where people can get outside and enjoy the ocean and are more central to our everyday experiences than we often realize. When astronauts first look back at Earth from space, they notice that Earth is blue. Let's take a look for ourselves.
In the 1960s, when astronauts launched toward the moon, they made an unexpected discovery.
I think I must have the feeling that the travelers in the old sailing ships used to have.
Earth is blue. We saw for the first time how vast our ocean, how fragile our planet, and how small and connected we appeared against the speckled blackness of space. Since then, our understanding of the ocean has grown immensely. And the more we learn, the more we realize the ocean is our life support. And now, it is in distress. Increasing demands of a growing human population are stretching the very fabric of nature. Pollution, overuse, and climate change threaten to undermine ocean health around the world. It became clear by the 1970s that we needed to do something to save our planet and the quality of life we had taken for granted. Not long after we first looked back at our planet from space, Congress passed the National Marine Sanctuaries Act, creating a nationwide system of underwater parks with the goal of preserving our natural and cultural treasures, empowering communities to be part of the process. From the depths of the Great Lakes to the sunlit shoals of the northwestern Hawaiian Islands, today, 14 sites serve as living laboratories and classrooms for ocean understanding and stewardship. These remarkable havens have become global models for how communities are balancing protection with recreation and commercial activities. We've made progress, and by changing how we interact with the ocean, we're investing in our own future. Our fates are the same. However, there is more to do. In 2014, NOAA opened the door for new national marine sanctuaries, inviting communities around the country to nominate their most treasured places in marine and Great Lakes waters. These are your national marine sanctuaries. Together, we are making a difference for ourselves, future generations, and that bright blue planet we call home.
We are tied to the ocean, and when we go back to the sea, whether it is to sail or to watch it, we are going back from whence we came.
Earth is Blue is a social media campaign launched by NOAA's Office of National Marine Sanctuaries. The campaign features one photo a day and one video a week to highlight the beauty and wonder of the National Marine Sanctuaries. We ask you to join us in the campaign by sharing your Earth is Blue recreational moment with hashtag Earth is Blue. So Dr. Zarr, have you had any kind of moment, whether it was Earth is blue or green or brown or any color for that matter, that has had a lasting impact on you? And if so, can you tell us, and has that really influenced you in the work that you do day to day?
I think it's a great question. I wore blue today. I would say that it's a difficult question to answer because there are so many experiences I think I had as a child. I remember even going to the Caspian Sea, through the Alborz Mountains in Iran for vacation, and every child, I think, who goes on a family trip to the ocean is so anxious just to get their feet in the sand. The color blue is a very powerful color. Water is not only important for our planet, but it's important for our human health. We're made of water. I think of my experiences going to Corpus Christi, to the Texas Gulf Coast. And even though it's not an ocean, I lived a few blocks from Barton Springs in Austin, Texas, and I spent almost every day of every summer near a body of water. And I really draw my inspiration from that because now as a practicing pediatrician prescribing parks and time spent in outdoor settings, I also know that there's a good deal of science now that supports not only spending time outside, but near a body of water. So that is the ultimate experience in terms of trying to improve your health and promote sort of wellness and create well-being in us.
Well, you do some pretty amazing things here in DC, and I'm just, with low-income immigrant populations in particular, and I'm just curious, is it common for your patients, especially, of course, the children, to frequent somewhere natural besides just the concrete jungle that is Washington, D.C.?
Well, it's actually an interesting fact that in DC we have about 20% of our land is green. So there's quite a bit of green space. And even in the neighborhood that I work, in the Community Health Center at Unity Healthcare, we've got Meridian Hill Park, which is just around the corner and has an amazing fountain. So it has a water feature to it. And it's really not that strange of advice for many of my patients when I suggest to spend a little bit more time in outside settings, especially in parks. Of this outside space that we have, most of it is owned and operated by the National Park Service. And really kudos to them for maintaining this space and preserving a space for us, not only to recreate, but to eat our lunches, to walk through on our way to work, to walk through to buy groceries, and to even have community gardens.
Yeah. So the outdoors doesn't just have a positive effect on people's minds, but their body as well. Can you explain the broader relationship between health and outdoor recreation, and more specifically, what have you noticed in your practice?
Sure. Well, I think it's a known fact that we've had a doubling in the rate of obesity in children in the last 20 years. And it's even worse in some ways for adults. So there's a large category of disease I like to call chronic disease, and that includes things from diabetes to high blood pressure, asthma, and obesity contributes to not all of them, but a lot of these problems. In addition to all of that, chronic disease also includes mental health problems like depression, anxiety, attention deficit, hyperactivity disorder. So we know now from a good body of scientific literature that spending more time in natural settings like parks, especially with water features, improves not only our wellness, our feeling of wellness, but our health outcomes. We actually do better. Our blood pressure goes down, our heart rate goes down, we're more relaxed, and we tend to just feel better and be better.
Yeah. Well, Maria, I have to say, I'm awfully jealous of where you live and where you work, because you have one of the most amazing views in our country, actually, looking out over the bridge off of San Francisco and Alcatraz, and it's just people recreating all the time, right out in front of where you are. So in order to be amazed by where the earth is blue and benefit from exercise, like Dr. Zarr was talking about, people need to have access to clean, safe outdoor spaces. But our nation's, now 13 national marine sanctuaries are excellent places for Americans to do that. How does the sanctuary system support outdoor recreation, and what can people do at a sanctuary?
Sanctuaries have multiple levels that people can come and get involved in. We have school programs where we bring students and classrooms out to the beach, get their feet wet, have them look for crabs, and learn about the beach ecology and have fun. Part of it is just having fun, enjoying it. And then we like to build upon that program and have families, provide opportunities for the families to come back. So the students can then bring their parents. And we have programs, family programs, where they take water grabs and look what's living in the water, help feed the fish in our tank in our visitor center. And then we have adult programs where we bring adults out into the sanctuary, kayaking, paddle boarding, whale watching. So there's many opportunities for people to get involved in sanctuaries.
Well, I heard that there were some students that you were working with in particular from Oakland, which isn't, that much further, west from, or east, I should say, east from San Francisco, that hadn't really even been in the ocean before. Is that true? Is some of the programs you guys do?
It's definitely true, and it's not only Oakland. In San Francisco, even though we're a peninsula surrounded by water, there are kids who have never seen the beach. And we have programs that go into those inner city neighborhoods and bring the kids out to the beach. And we've actually gotten comments that they've asked what lake it is. So it's an opportunity, again, bringing those kids out there and exposing it to them, and then having opportunities for their families to join them. And it really does change lives, having that experience.
Well, and now you have this great, amazing announcement that came out yesterday. It goes from the Gulf of the Farallones National Marine Sanctuary to the Greater Farallones National Marine Sanctuary, expanding 2.5 times of what you are right now. Can you tell us a little bit about yesterday's big announcement and what it means for you?
Yesterday was an extremely exciting day for me personally because the sanctuary expanded. We more than doubled up the coast of California, and now we fully protect one of the most productive areas of the ocean. It is so incredibly rich there because of the deep water rises to the surface, and when the sun comes out in the summer, it blooms. There's lots of critters that come and feed off the small plankton, which brings the whales, the dolphins, the seals, sea lions, seabirds. It's an amazing place, and now it's fully protected.
Well, I'm really excited about that. And Matt, I'm going to bring you into the conversation. Being from Surfrider Foundation, obviously some of the country's best surfing is along the California coastline. Can you tell us a little bit about some of the things that you work on to ensure that people understand the importance of the ocean?
Yeah, Surfrider has really been working around the country to try to quantify where people are recreating along the coast, and trying to figure out where they recreate, but also how much money they're spending, because people come into communities to recreate and do these things along the coast. They're spending a lot of money, and we all know that money talks and jobs talks a lot in politics. So we're really trying to quantify that and show the impact they're having along our coast, just coming to enjoy the beach or surfing or diving or whatever they're doing.
So can you tell us a little bit about the difference between consumptive and non-consumptive uses? I know that in your study you went into the specifics about that. Can you tell us what that means? Yeah,
non-consumptive recreation is kind of a weird term, but it really just means anyone who's coming to the beach just to relax or to go diving, and you're not taking anything. Surfing, obviously, and a lot of times this group of people is not counted. It's hard to quantify their use. It's not as easy to quantify as something like fishing or shipping or another use of the ocean. So we're really trying to get those people and make sure their story is told when we're making plans for our ocean.
Well, can you tell us what beach activities were the most popular from your study?
As you can imagine, just your regular Joe beachgoer was the number one thing. So many people from across the country, that's their thing every summer, especially in the Mid-Atlantic where I work. Every summer they come to the Jersey Shore or they go down to Virginia Beach or something like that. So that was the number one. There's also a lot of people that come out for just hiking, biking, camping, and then obviously you have your more specialized things like surfing and diving.
Well, so the coastlines are only a part of our country, but it seems like most people spend their money going to the beach. So I know that your study talked a little bit about that. What were some of the results?
Yeah, we found some big numbers. In the Mid-Atlantic where I work, we found that the average person who comes spends $70 per day per person. So that's a big number when you think of millions of trips people are taking to the coast every year. So it's a really big chunk of change in the millions of dollars every year of people coming to the coast and just enjoying it, the healthy ocean ecosystems.
So being from Surfrider Foundation, do you surf?
I surf badly. I enjoy diving. I enjoy camping on the coast. Anything where you can get out and just relax and see the water and be with friends and family is a great time.
So, Dr. Zarr, from National Marine Sanctuaries to public parks in D.C., people can find nature in their own communities anywhere, really. And you created the Park Prescription Project. And I would love for you to prescribe for me to go surfing in Maria's expansion area. But can you tell us about how you came up with the idea for that project?
Well, there's nowhere to surf in D.C.
Yeah.
I don't think.
Delaware.
Yeah,
about
not
2.5
too far,
hours.
about 2.5 hours, you're right.
Yeah.
Well, so the interesting thing is that I didn't actually create the idea of prescribing nature. And I have to give credit to the National Park Service, and even before that to Australia, because their Park Service came up with this notion of healthy parks, healthy people, and the relationships really between parks and people. And part of HPHP, or Healthy Parks, Healthy People, is prescribing parks. So that's where it really came from. What I did with it is I ran with it. I said, you know what? Why isn't it that I don't have easy access to this in the office when I'm seeing my patients? And if Joey, says he likes to ride bicycles, or he likes to hike, or he likes to play tennis, why can't I go to one place and find all the information where he and his family can do that activity when they want to, the closest one to their house, how to get there, what's there when they get there, water fountains, benches, can they picnic there, on and on and on and on. So when I sort of started this task of figuring out, does this exist, I found out it doesn't exist. No such database or search engine exists like this anywhere in the country that I know of. So we went at the task of basically mapping out all the green space, rating it for the things that you and I and doctors need to know before we decide we want to use it or prescribe it in our case, and have it accessible electronically. So everything's electronic now with our health record, and we put a hyperlink into our electronic health record, and I can literally prescribe parks, sometimes instead of medicines, to my families, to my patients, who I think and they think are ready to use park space more.
Well, what effect has the project had on your patients from both you and their perspectives?
It's a very good question. So we did a little study, a tiny study in 2013, and we followed about 200 families who had been prescribed a park. And we looked at the before and after results. And what we found was that if a child was prescribed a park by their doctor, they were going to spend about 22 more minutes in physical activity per week. And they would spend more time outside, so green exercise. So I'm pretty confident that I could say to you that prescribing a park does work. It actually does influence behavior, and it gets people to spend more time outside.
So just a quick question about it. Did you create a baseline study prior to starting the prescriptions, and then now you're kind of seeing what might the impact be on obesity or ADHD or large issues like that on some of our children? Are you working on that?
Another great question.
Yeah.
So yes, I'm in the process now of looking at what we call biometrics. So we want to see whether, in fact, prescribing a prescription not only changes behavior and gets kids and families to spend more time outside, but does it, in fact, reduce their blood pressure? Does it improve their depression? Does it improve their ADHD, et cetera? These kinds of metrics that we can actually say at the end of the day make a difference. So we're getting there. We're actually organizing ourselves now and creating a study design and we'll begin to mine data from our electronic health record to look at exactly the things that you asked about.
Wow. Can it be, I mean, this is so cool. I love it. Can it be replicated? Are you working with other doctors across the country to do this?
I'm not the only one doing this kind of work. And so we have a national park prescription coalition of sorts. Nice. And I have colleagues all around the country who are either at the beginning stages or somewhere about the stage of where I am is organizing the database and getting it up and running. And so we're talking right now about a larger study to see if we can pool our data together, but also just to help each other to expand and collaborate on how to do this. And yes, it's replicable. I mean, there's no reason in most major urban centers around the world, frankly, that we can't use that space more.
Well, we have looked at the health benefits of outdoor recreation and options for people to access nature. I'm going to just give one last question for discussion from everyone. I think it's important to note where the future of outdoor recreation is headed. But oftentimes, with the media world that we live in and our phones and our iPads and, everything we've got coming at us, outdoors is sometimes the last places where people go, unfortunately. Or when they are in the outdoors, they're looking for that wireless signal. Or it's like, I was at the Partners Outdoors recreation thing the other day, and they're like, oh, we need to get this park wired because people can't find a place within the park to go to. And I'm like, wait a minute, the whole point of going to the park is to be outdoors and enjoy it. Let's not wire the parks. But, there's different people that think other things about that. But what are the barriers to getting people outside, and how can we overcome those barriers, especially for urban populations? Maria.
Well, I think our issue in San Francisco is we are a big urban area, and having the public transportation or having the funds to take buses from the schools out to the beach, it's there, it's in their backyard. It's just a matter of getting there, and that's the hardest part. I think that government programs could do more in terms of transportation, funding to get kids out there as part of education. That's, I think, a way we need to go, because it really does help heal people and heal communities being outside.
100%. Dr. Zarr?
Well, my particular focus is on the medical community, the health community, the public health community, to really get them on board, to raise the awareness of the science even in why it's important to prescribe nature and why it's important to get us outside. And it's a great question because we know that in 2030, 70% of the world's population will be living in urban areas. So parks will have even more relevance to our planet and to our lives more than ever before.
Oh, Matt?
Well, I'm lucky I live in New York. I get to take the subway out to the beach, which is quite an interesting experience. But a lot of our chapters do things where they help to teach kids how to surf, because it is a barrier. But through our work trying to collect this data on recreation and the economics, we're trying to make sure these areas are protected and well taken care of into the future, so these areas are there. And I wanted to just mention, there is some preliminary research. Surfers often talk about stoke, which is this funny term that just means you're feeling great. But there's some research showing that there might be actually a chemical thing going on because of the wave action and the oxygen that gives you a great feeling. So it's an interesting thing where it's a chemical thing might actually be backing up a good feeling.
Wonderful. Great ending. I got goosebumps. I'm stoked to go surfing and go to Maria's expansion event at the end of June. So anyway, thank you so much for all of you for joining me today and talking about this wonderful topic. And I'm really excited to hear more about what you're going to be doing in the future with your prescription project. So thank you so much, and it really impacts the lives of every American, what we've been talking about today, whether it's in your backyard, a park, a national marine sanctuary, the beach. Get outside, get active, and find out what you enjoy about nature. And if you already know what you like, try something new. It's good for your health, our economy, and our environment. We're back to Chow at 11:15 p.m., and I hope to see you for the lunch session of Capitol Hill Ocean Talk at 12:15 p.m., where we have a panel about how ocean planning can be used as a tool to manage competing ocean issues, which follows Matt's earlier points. Please see the Oceans Live schedule immediately following this session for more broadcast information. And stay tuned right after this for a stunning expansion video featuring Greater Farallones and Cordell Bank National Marine Sanctuaries. Keep your internet browser on oceanslive.org, and thank you for watching.